would look like in someone with abnormal rhythm, such as atrial fibrillation. So first, an ECG, also known as an EKG, is what measures the electrical activity of the heart. The SA node, which is located in the right atrium, is the heart's natural pacemaker. So it initiates the electrical signal, which then spreads to the atria, causing them to depolarize and then thus contract, which is seen as the P wave right here. And then the signal briefly slows down at the AV node, which this pause is called the PR segment, and it basically gives time for the ventricles to fill with blood. The PR segment is seen right here. And then the QRS complex is when the signal travels down through the bundle of His and the Purkinje fibers, causing the ventricles to contract. And then finally, the ventricles repolarizing, resetting the heart, which is seen as the T wave right here. So what is atrial fibrillation, also known as AFib? It's an irregular and often very rapid heart rhythm that originates in their atria. So instead of the SA node controlling a single steady impulse, multiple other areas of the atria, called ectopic foci, start firing their own electrical signals. And these signals are often disorganized and chaotic, so instead of the atria contracting like normal, they begin to quiver, which is what we call fibrillation. So this basically causes blood to not move very efficiently through the heart, and this shows up on an ECG as very irregular. AFib risk factors include things like aging, hypertension, which is high blood pressure, diabetes, hyperthyroidism and other thyroid issues, heart failure, obesity, alcohol use, and prior strokes. So, what does atrial fibrillation look like on an ECG? So, as I just described, in a normal ECG, you can clearly see the P wave right here, the PR complex right here, the the PR segment right here, the QRS complex, and then the T wave, and then a resting phase. And then the beats are spaced pretty consistently over time. But in AFib, one of the main characteristics is that there's no P waves, there's this like stop signal or anti sticker I put right here. The atria isn't depolarizing in an accordant way, so instead fibrillatory waves are seen, which are these tiny, like very irregular squiggles caused by the ectopic impulses of the various ectopic areas in the atria. Also, the spacing between the QRS complexes is very irregular, so it's compared to the normal, there's no like even spacing. And there's also no flat baseline between the beats either, because the atria never truly rests because it's constantly receiving those random and irregular conflicting signals. So what are the health concerns and common treatments? Because the atria isn't pumping blood properly, this can be very dangerous because this can cause blood to pool and then form clots. And these clots can then travel to the brain and cause an ischemic stroke. It's a fact that people with AFib have 5 times a higher risk of stroke. And AFib can also increase the risk of heart failure and sudden cardiac arrest. So we treat it by preventing stroke first with anticoagulants like warfarin or DOACs, and then to control the heart rate, medications like beta blockers or calcium channel blockers are used, and then Cardioversion is also used in some patients, which resets the heart rhythm, or catheter ablation to destroy like the, how do I put this, the embolitic areas in the atria that are producing the rogue signal. And then also like lifestyle changes can help prevent AFib, like weight loss, treating sleep apnea, and also if you have AFib already, lifestyle changes can help prevent stroke. And that is all. These are my references. Thank you for watching.